your dentist just told you you have some recession, maybe some translucency on your front teeth, and they offered you a cosmetic solution, bonding, veneers, something to cover it up. But what if those changes in your smile aren't just cosmetic? What if they're actually distress signals, biological warnings that something much deeper is going wrong inside your body? Because here's what most people don't realize. Your mouth isn't separate from the rest of your body. It's a window. And when you start seeing certain changes in your teeth and gums, they're often the first visible sign of chronic nutrient depletion that's been happening for months or even years. Look at your smile in the mirror right now. Not the shape, not the color, the edges, the gums, the corners of your mouth. Because here's something your dentist probably never told you. Your teeth are not just tools for chewing. They are biological record keepers. And your gums, they're not just pink scaffolding. They're early warning systems. Today we're looking at 3 specific oral markers: translucent enamel, receding gum lines, and persistent cracks at the corners of your mouth. Most people see these as cosmetic problems, something to whiten, something to fill, something to put cream on. But researchers who study nutritional biochemistry see something else. They see biological distress signals, deep-seated mineral deficiencies that have been brewing for months or years. Your mouth is a diagnostic window into chronic internal depletion. And if you know what to look for, your smile will tell you exactly what your cells are starving for. Let's get into it. First warning sign: translucent enamel, specifically along the biting edges of your front teeth. Here's what healthy enamel looks like: opaque, solid, slightly off-white. But when enamel starts to wear thin from the inside out, it becomes glassy, see-through. You can actually see the darker dentin layer underneath the incisal edge. Most dentists will tell you this is just wear and tear, acid erosion from soda or coffee, and that can be part of it. But here's what they miss. Enamel is the hardest substance in your body, harder than bone, and it's not alive. It doesn't have blood vessels. It doesn't repair itself like skin or bone. But enamel is formed by living cells called ameloblasts. And those cells are incredibly sensitive to your nutritional environment, specifically to 3 things: calcium, phosphorus, and vitamin D. Here's the mechanism. Ameloblasts deposit enamel crystals called hydroxyapatite. That's a calcium phosphate mineral, but they can only do this efficiently when your blood levels of calcium and phosphorus are stable, and when vitamin D is present to regulate that balance. When you're chronically deficient in any of these, the enamel that forms is weaker, thinner, more porous. And here's the part that's really important. Enamel formation happens almost entirely before your permanent teeth erupt. By age 12 or so, your enamel is set. You don't make new enamel. So if you were malnourished as a child, if your mother was deficient in vitamin D during pregnancy, if you grew up on a diet stripped of minerals, that enamel is compromised from day one, and it shows up as translucency, as chips, as rapid wear that seems to happen no matter how well you brush. But there's another layer to this. Even after enamel is formed, your saliva plays a role in maintaining it. Saliva is supersaturated with calcium and phosphate. It constantly bathes your teeth, repairing microscopic defects. This process is called remineralization. But when your body is chronically depleted of these minerals, your saliva chemistry changes, the mineral content drops, and the repair process slows or stops. So translucent enamel is actually 2 signals at once. 1, your enamel may have been poorly formed to begin with. 2, your current mineral status isn't supporting remineralization. The nutrient connection here is clear: chronic calcium deficiency, phosphorus deficiency, or vitamin D deficiency. And these rarely happen in isolation, because calcium absorption depends on vitamin D, and phosphorus is often low in processed food diets. So when you see that glassy, see-through look on your front teeth, your body is telling you something. Your mineral reserves are running on empty. Second warning sign: receding gums. Not the kind that happens because you brush too hard, the kind that happens without obvious mechanical cause. Your gum tissue recedes up the tooth root, exposing darker, yellower surface. This is incredibly common, and most dentists will tell you it's just aging or genetics. But here's the nutritional story. Your gums are soft tissue, and like all soft tissue, they require specific nutrients to maintain structure, specifically vitamin C and collagen. Here's the mechanism. Gum tissue is rich in collagen fibers. Those fibers anchor your gums to the underlying bone and to the tooth surface. Collagen is produced by cells called fibroblasts, and vitamin C is an absolute requirement for collagen synthesis, not a helper, a requirement. The enzyme that cross-links collagen molecules, it won't work without vitamin C. When vitamin C intake is chronically low, collagen production slows, the fibers become weaker, less organized, and the gum tissue starts to pull away from the tooth. This is not a fast process. It takes months or years of low-grade deficiency, but it's measurable. Studies have shown that people with lower plasma vitamin C levels have significantly more gum recession, independent of brushing habits, independent of smoking, independent of age. But vitamin C isn't the only player here. There's also coenzyme Q10. CoQ10 is a compound that cells use for energy production. Gum tissue has very high metabolic activity. It's constantly turning over, and CoQ10 is essential for that turnover. When CoQ10 levels drop, gum tissue becomes fragile, it heals poorly, and it recedes. Here's where the connection gets interesting. CoQ10 levels are directly affected by statin medications. Statins block the same pathway that your body uses to make CoQ10. So if you're on a statin and you have receding gums, that's not a coincidence. And there's a third nutrient, magnesium. Magnesium is involved in over 300 enzymatic reactions in the body, including those that regulate calcium balance. And calcium balance affects gum tissue through something called subgingival calculus. When magnesium is low, calcium can become dysregulated. It deposits in soft tissue where it shouldn't be, including under the gum line. That calculus buildup pushes the gum tissue away, causing recession. So receding gums are rarely just one deficiency. They're usually a cluster. Low vitamin C, low CoQ10, low magnesium, and sometimes a diet too high in inflammatory omega-6 fats, because inflammation accelerates gum breakdown. And guess what drives inflammation? The same industrial seed oils we talked about in previous videos. So your receding gum line, it's a window into your systemic inflammatory burden and your body's ability to repair its own tissue. Third warning sign, persistent angular cheilitis, those painful cracks at the corners of your mouth, the ones that bleed when you open your mouth too wide, the ones that come back no matter how much lip balm you use. Most people think this is just dry skin or a fungal infection. And yes, yeast can colonize those cracks. But why is the yeast there in the first place? Because the tissue is compromised, and the tissue is compromised because of specific nutrient deficiencies. Here's the breakdown. Angular cheilitis is classically associated with B vitamin deficiencies, specifically B2, riboflavin, B3, niacin, B6, pyridoxine, and B12, cobalamin, but also iron and zinc. Here's what these nutrients actually do. B vitamins are essential for cell turnover. The skin at the corners of your mouth is some of the most rapidly dividing tissue in your body. Every few days, those cells replace themselves. But cell division requires energy, and energy production requires B vitamins as cofactors. When you're low in B2 or B3 or B6, that cell turnover slows. The skin becomes thin and fragile, and microscopic cracks form. Then moisture accumulates, yeast grows, and you get that persistent red, cracked, painful lesion. But here's the part that most doctors miss. Angular cheilitis is often a sign of broader malabsorption. Because B vitamins are water-soluble, they're easy to get from food. If you're deficient in them, despite eating a decent diet, something is wrong with your absorption. Common causes: low stomach acid. This is huge. Without enough stomach acid, you can't extract B12 from protein. You can't absorb iron properly. You can't absorb zinc. And all of these are required for healthy tissue at the corners of your mouth. Another cause: gut dysbiosis. Your gut bacteria produce some B vitamins. If your microbiome is disrupted, that internal production drops. Another cause: chronic diarrhea or inflammatory bowel disease. Anything that speeds intestinal transit reduces absorption time. So angular cheilitis is not just a skin problem. It's a red flag for your entire digestive system. And the nutrient deficiencies involved, B2, B3, B6, B12, iron, zinc, these are not rare deficiencies. They're incredibly common in modern diets, especially in people who avoid animal products. because the most bioavailable sources of these nutrients are meat, eggs, and dairy. Plant sources exist, but they're often bound to compounds that inhibit absorption. So when you see those cracks that won't heal, your body is screaming for B vitamins, iron, and zinc. And it's telling you that your gut might not be absorbing them. Now let's connect these three signs: translucent enamel, receding gums, angular cheilitis. These don't usually happen in isolation. They happen together because they share root causes: mineral depletion, vitamin deficiency, and often a diet that's high in processed foods and low in nutrient density. The modern food system has stripped out the very nutrients your teeth and gums need to stay intact. Calcium is low in processed foods. Phosphorus is displaced by additives. Vitamin D is absent unless fortified. Vitamin C is destroyed by heat and processing. B vitamins are removed when grains are refined. Magnesium is depleted from soil and then from flour. Zinc is lost in milling. So you're eating plenty of calories, but your cells are starving. And the first place that starvation shows up: high turnover tissues, the mouth, because the mouth is constantly under stress. Chewing, temperature changes, bacteria, mechanical force. It's the canary in the coal mine. If your body is running low on resources, your mouth will show it before almost anywhere else. So what do? First, don't ignore these signs. They are not cosmetic, they are diagnostic. Second, focus on nutrient density, not calories, nutrients. For translucent enamel, calcium from dairy, leafy greens, or bones, phosphorus from meat, eggs, fish, vitamin D from sun, fatty fish, or high-quality supplementation. Consider a remineralizing toothpaste with hydroxyapatite. But understand that you're treating the symptom. The root cause is internal depletion. For receding gums, vitamin C from whole food sources, not supplements, not orange juice from concentrate. Fresh citrus, bell peppers, kiwi, broccoli, CoQ10 from organ meats, sardines, or supplementation if you're on a statin. Magnesium from dark leafy greens, nuts, seeds, or Epsom salt baths. And reduce inflammatory seed oils, because gum tissue cannot repair itself in a high inflammatory environment. For angular cheilitis, B vitamins from nutritional yeast, liver, eggs, or a B-complex supplement. Iron from red meat, organ meats, or blackstrap molasses. Zinc from oysters, beef, pumpkin seeds, and most importantly, check your stomach acid. If you're deficient despite eating well, consider betaine HCl with meals, or work with a practitioner to rule out malabsorption. Here's the bottom line: your smile is not just a social asset, it's a biological dashboard. Translucent enamel tells you about mineral status during development and current remineralization. Receding gum lines tell you about collagen synthesis and tissue repair. Persistent angular cheilitis tells you about B vitamin reserves and gut absorption. These three signs are not separate problems. They are the same problem: chronic internal nutrient depletion. And the solution is not a better toothpaste, or a more expensive lip balm, or gum graft surgery. The solution is feeding your cells what they've been starving for: real food, nutrient-dense food, calcium, phosphorus, vitamin D, vitamin C, magnesium, B vitamins, iron, zinc. These are not optional. They are the raw materials your body uses to build and maintain every structure in your mouth. If you've been struggling with any of these three signs, I want you to look in the mirror right now. See them for what they are: not cosmetic flaws, biological alarms. And then ask yourself, what have I been feeding my cells? If you want to go deeper, I have a follow-up video breaking down exactly how to restore your gut health so you can actually absorb these nutrients. Click the screen right now, and I'll see you there.